Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
This week is less oral and more brain stimulation, right? So it's interesting because this is the first time in my experience in the Expat Club that we've ever had like a talk on something medical that none of us had any familiarity with before. And of course, brains are pretty important, right? And the fact that these people try to help people with brain fog. I'm not going to look at anybody. I'm trying not to look at the people with brain fog, okay? People with brain fog and who had strokes and all sorts of things. And then we've got a little talk from Tanya, who has arranged so many speakers in the club and what she's doing now. And I think it'll be a very amazing morning at the club. I'm a bit worried about these poor nurses having to stand up all this time. It's going to be a very interesting morning in the club, to put it mildly, and we'll all come away knowing something more about this new modality that we haven't heard of. So I really want to thank Dr. Somrot. Wait, come back here, Tanya. Tanya, come back here. I don't get to order women around very often, so this is pretty cool. So Dr. Somrot's going to give the talk. Can you say a couple of words about Dr. Somrot and his background?
Why don't you? Yeah, just kidding. Thank you very much for today. I'm very glad to come back here as like my second home. So about today, I'm very excited as well, and I believe that you are looking for something new technology for helping you brain working more than ever. It's like get back when you are younger than now. Even your face look younger, I understand that. But today, Dr. Somrot Phonglamai, he's very specialized on the brain stimulation. It's not just the stimulation, it's advanced brain stimulation. He's a great speaker in this world, I could say that. But you have to close the door because if someone hear me talk about this, it will be, you are over advertising right now. So he's an international speaker and he's the one, he could be the first specialist who brought this technology to Thailand. They aim to bring this advanced technology because he would like to help people, especially Thai people, who can access the technology and helping them to have a good brain with accessible cost. So what are we going to hear today is what he has experienced for more than 12 years. So please welcome Dr. Somrot.
And he's going to give you enough brain stimulation, so turn off your phones off or to vibrate and let Dr. Somrot do the brain stimulation.
And there will be some excited and surprise after the talk, so please keep an eye on it.
Thank you so much, Sawadee krab. Don't trust, just prove. This is my concept. Don't trust any doctor in the world, including me. Just prove me with scientific things and your logical things. So, bonjour, comment allez-vous? Guten Morgen, hola. Good morning, ladies and gentlemen. Today's topic is the brain fog, forgetfulness, and feeling down. Reverse before it's too late. So, I'm Dr. Somrot Phonglamai, the Board of Physical Medicine and Rehabilitation, and also the international brain stimulation expert. So you have the notebook and pen with you right now. Please get it. We will play the game. This is not a typical lecture. Place your notebook and your pen, please. We will test the game, the cognitive game. Please, everyone. And this game, it will be fast to test your brain speed. Okay. So, don't ask each other. 100 minus 7. Put the answer into your paper right now. Don't look your friends. Right now, 100 minus 7. Again, that answer -7 again. Write it down in your notebook right now to test your brain. It's important. -7 again. The total is 5 answers, the 5 numbers. From 100, -7. And then you got the answer, -7 again. Again, and again. Take your time. It's very important to see what is your calculation brain right now. Okay, the correct answers. This is the answer. So, to be frank, who got them all? This is the correct answer, right? Oh. Okay, never mind.
No, seriously, you missed one of the 7s, the first 7s. There should have been 6 7s deducted. The final answer is 58, correct?
Good, very good. That's why we test, yes, yeah. And this is very important to test your focus, calculation, and the brain speed. Next, the memory things. So, put the pens down. Close your notebook. Don't write this word. Just memorize. Don't write. Okay? Remember this word in the exact order. Don't speak it out. Just remember. Okay? Memorize it. I will ask you later to test the brain. Okay? So, just memorize it. Our first topic today is brain fog and forgetfulness. Anyone in this room, please raise your hand if you have slow thinking, less concentration, forget words or name easier, feeling down, blue, depressed, or loss of motivation. Who have this? All of them. Or some of them. If you have some of them, the symptoms could be only the brain fog. It can be temporarily, or it could be dementia, that's more severe, or the Alzheimer's disease, the most severe form.
Apparently it's a little too loud, is that right? No. Only 2 guys up the front think it's a little too loud. Oh, a few. Can we turn down the volume a little bit?
Oh, I can reduce my volume. It's okay, this volume? Okay, next. So, if you have these kind of symptoms, so we will focus on the dementia and Alzheimer. So, right now, we will go to the next slide. Can you write? Yeah. Not yet. Okay. Can you remember what the 5 words in the exact order? Talk to yourself. Remind, recall. Okay. Write it down into your notebook right now. Don't see each other's. The words, the 5 words in exact order. Can you remember all? Okay, finish. So the answer is face, velvet, church, daisy, and red. Who got them all? The exact order. Wow, your brain is still young. Good. But who cannot remember all of them in the exact number? So maybe we have some memory problem, maybe temporarily or maybe permanent. So we haven't know yet. So who feel that our brain now, when we getting old, our brain is worsening. Me too. And who need the brain well? Me. Please raise your hand. Do you want or need the brain well or better? Yes, most of you want the brain better. So that's why the topic today. Okay, so we need to prevent our brain to getting worse. We want to keep our brain fresh, fast, smart, and happy, right? This is what our need in our life. So this is the source of our slides today. So who is your speaker today? I'm Dr. Somrot Phonglamai. So next, you know that I'm the physical medicine and rehabilitation. We call the physiatrist, not the psychiatrist, different with the physiatrist. And we have the brain stimulation 14 years experience in TMS. I will show you later how about TMS. The TMS is the magnetic stimulation that you tested in the morning. And I'm the co-authors of the textbook of neurology from the Springer in this year. I do the research about the TMS in CP children since 2011. And we do the 15 conditioned brain stimulations, the FDA and CE mark approved. So, our work, I have been working at Bangkok Pattaya Hospital, and then because of my passions of the brain stimulation, and the result is quite excellent. So, we set up the Brain Biomedical, the advanced brain stimulation. Right now, we have the physiatrist, the rehabilitation Dr. Raimi and Dr. Ponsi, as you see in the leaflet, and the neuromedicine Dr. Song Tom here today. We have the consultant of neurosurgeon, pediatrist, and we do around 40 to 60 sessions brain stimulation per day, both Bangkok and Pattaya branch. So we are also the research advisor and consultant of the brain stimulation. So don't trust, just prove. It sounds impressive, but don't trust any doctor, in my opinion. Okay, next. So the first topic is brain fog and forgetfulness. So for dementia, we focus on dementia and Alzheimer's today. It has the reversible and correctable causes, and this is important. For example, some patients have the vitamin B12 deficiencies or hypothyroidism, or some have the alcohol consumption too much, or some medications that cause the dementia to the patients. So if we can correct this cause, it's very good, so we correct the cause. But we have a reversible cause too, like Alzheimer's disease, like some other dementia, or some stroke that have the vascular dementia. In this room, who have stroke or have the relatives have the stroke problem? No? Good. And some infections like syphilis or AIDS and some meningitis can cause this dementia in the future. So we focus on Alzheimer's. This is the brain well, and this is the brain atrophy, the brain worse in Alzheimer's disease. Who want this one? No. But this is the risk factor that can trigger this one. So count the risk factors. How many of you or how many factors you have today? The inactivity, the exercise less than 15 minutes per day. If you have this factor, count one. And smoking, just one cigarette or two cigarettes is smoking too. If you smoke like a one pack per day, it increases the risk double time for dementia. So if you smoke, count one more. And alcohol consumptions, if you drink a can of beer more than 3 cans per day, That's a high risk of dementia. It's about around 3 glass of wine. Okay. Next, the air pollution. All of us exposed to air pollution, and we cannot avoid. In the morning on the beach, you see the lack of fog, the PM 0.5, 2.5 among the country. So we cannot avoid it. So everyone in this room have this risk factor. Next, the head injury. If you have some traumatic brain injury, falling down, bleeding, or some brain concussions, you have the high risk of dementia. Next, the infrequent social contact. I think that who came to this room have the social contact. And less education, less than grade 9, can count one more point. Obesity, hypertension, diabetes, depression, and hearing impairment. So, how many that you have these factors? Summarize in your mind. Who have at least 3 factors? Yeah, at least 3 factors. So the higher risk factor, the higher dementia in the future. Okay, this is the brain well, the healthy brain, and in the spec image of the healthy brain, we show the blood flow and activity. The good activity shown in red and yellow like this. And this is the healthy brain. And at the brain burst, or the Alzheimer brain, this is such a trophy brain, at the dementia or Alzheimer's disease. And the spec image show low activity and low blood supply, especially the posterior part, the parietal lobe, the back of your head, and the median temporal lobe and the frontal lobe also. So for dementia, brain atrophy, reduce in activity and blood supply. And guess who E or F, who is Alzheimer? Please answer. That's right, correct. And guess who's older? Just guess. So, in this Alzheimer's disease patient, he's 71 years old, and this healthy brain is 90 years old. So, if we keep our brain healthy, if we keep our brain clear from the toxin, and that's risk factor, if we prevent our brain to keep healthy like this, even you are 90 years old, your brain is still fast and young. But if you still have that risk factors, or the toxin inside your brain accumulate years by years, it's permanent damage to your brain, even you are younger. So prevention is more important than treatment. And the older age can be still young brain. We know that 80s or 90s here, that's still very clever and fast. Okay, this is the connection inside the brain. In the brain well, healthy brain, we see this connection. The stronger connections, the more clever and more faster brain. And in Alzheimer's disease, what happened inside? You see this is the frontal lobe. The memory part, intelligence, calculations, and emotional control, behavior control. So it lost these connections. So the brain is slower. The behavior is changed. Personality is changed. Blizzard or strange behavior cannot control themselves. So this is in the Alzheimer's brain. So next is the blood flow inside the brain. We measure the blood flow in the frontal part of the brain, and if the blood circulation is good, it will show in the yellow color here. But in the Alzheimer's disease, you see, the yellow color is less, so the blood circulation to the brain is much reduced. And that's why the reason we test the brain, why we test it. That we test your brain, the frontal side, the posterior side, to improve the memory and also many calculation of focus. What inside the brain, dementia and Alzheimer, is called amyloid, or beta amyloid, amyloid beta. So every name is okay. This is the brain of dementia. We have the toxin called amyloid beta plaque or tau protein later, neurofibrillary tangles. So remember only the amyloid. This amyloid accumulate inside our brain, and this is the real amyloid. And everyone right now in this room have amyloid. But this amyloid get rid of every day, clear daily, with when we sleep, when we exercise, when we have good emotions. Every day it will clear this amyloid. But if we have many risk factors, the accumulation more and more and more and more, and damage permanently. So we can detect the amyloid with the amyloid PET scan. The more red color here, black and red, the more amyloid deposit in our brain and get our brain worse. Okay, this is the normal cognitive functions. When we getting old, our functions, cognitive function decline as we age. This is a normal. But if you have the amyloid, beta amyloid deposit more and more and more, and we can see this dashed line is a dementia dashed line. So your cognitive function drop faster if you have this amyloid beta inside your brain more and more. And the amyloid deposit 10 to 20 years before it shows the symptoms. So if you have the memory problem today, so this event is called preclinical phase, maybe 20 years earlier. So what if we can clear that toxin before we have the symptoms? That would be better. The prevention is more important than treatment. Okay. The Alzheimer's symptoms, the peak age is around 70s. But in many cases, the early onset on 60s. And we know that the deposit of the amyloid beta 20 years before the symptoms occur. So maybe 40s is the time to prevent it. That's a good question. How old? I mean, it's not too late. If you're sitting today, it's okay, it's not too late. But if you let the symptom appears, when the Alzheimer's starts, it never stops. Remember this. And at the end stage, you cannot remember your daughter's names, your son's name, even your name. So if you have the Alzheimer, and when it starts, never stops. Remember this quote. So prevention or treatment is more important. Prevention. Okay. So this is the Alzheimer treatment that you can do by yourself with the medications. If you have to see a doctor, you will have the medications, and you have the physical activity that prevent the exercise that can prevent the dementia or depression. The music therapy is okay. The social activity that you attend here, also the prevention. Also some herbs and some supplements like melatonin, vitamin E, or curcumin is good for you, but the appropriate dose is required. If it's too much, it will have the side effect too. And then some herbs like a ginkgo. Ginkgo can help, but if you take too much ginkgo, your bleeding is easier and harder to stop. Okay, and then this standard treatment is essential, is good, but it needs a long time and the effect quite slow. So what if we can help our brain deliberately in the frontal side, medial side, and parietal side, posterior side, to make the brain faster? The next problem is feeling down. The feeling down, okay, We give you the Hamilton Depression Rating Scale in your plastic bag. Who complete this already? Yes, it's important to measure your mental health. And how much the score? The score can tell the severity. Who has more than 13? Please, you need help. This is important. So for the audience who haven't completed this questionnaire, please, you can do it. If you can remember 13, 13 is a good number to remember. So if you have more than 13, you have moderate, severe, or very severe depression. We help many suicidal patients, and it can reverse the suicidal ideation in 2 weeks. So this is important. So if who have more than 13, please come to our staff or me or our doctors. You need help. Okay, this is the brain of non-depressed, healthy, and the brain of depression. We see this. The activity in the brain, how about it? Much less. So the activity in the brain is much less, and it lost many brain function, especially in the frontal parietal lobes. And you see, this is the functional MRI. We can see that on depression, what happened? The function of the brain is much reduced. And they will feel lack of motivation, lack of energy, don't want to do anything, boring, loss of motivation. If you have this, maybe you need help. Okay, next. So this is the causes. From the Nature journal, there are many causes that cause depression. Some are the chemical substance change, some are genetic mutation, some are the prefrontal cortex dysfunction. These are in the frontal lobes of the brain. So that's why we stimulate on the left frontal side if you test it. And some stress trauma event can cause depression. Environmental factors like pollution we cannot avoid. The high-fat diet, the psychiatric disorder if you be the comorbid of depression, change in the neurotransmitter, the chemistry substance inside the brain change, some stress and trauma, the social and financial problems, some substance abuse like alcohol addiction or some cannabis cause depression, and hormonal disbalance. When we're getting old, our hormone is imbalanced, more than normal. And chronic medical conditions like heart failure, renal failure, or some chronic disease like diabetes can cause all the depression. Yes? Sure. Yes. Yes, the genetic problems. Yes. So, very strong. Because it's inside our gene. The mutation, some mutations can cause depression, or some genetic problem that's transferred from mother to son. We cannot fix the gene. I cannot fix the gene, but I can fix the brain. Yes. Who in this room, the audience, who have more than 3 factors? If you have more than 3 factors, so you have more possibility to have depression in the future. And those factors can cause the chemical change inside our brain, so it can cause the depression. And the treatment and the prevention, this is you can do by yourself, easier, safer, and the budget. So sleep well is very important, very, very important, because it's clear the toxic substance, it's clear the anxiety of feeling bad substance get out from your brain. And some dietary adjustment, more plant-based or Mediterranean diet can keep your brain healthy. Your social interventions, family, friends, or social support can help you to get more, less depression, more happiness. And exercise. Exercise every day for 30 minutes at least can keep your brain healthy and not depressed. And then the antidepressant or the medications is good and cheap, affordable, but many patients have the side effect like headache, loss of appetite, maybe loss of libido too. And then anxiety, confusions, like a constipation or diarrhea. So what if we can have the more precise and personalized treatment that help the depression combined with the standard treatment? So this is the summary of the treatment of Alzheimer's and depression. The lifestyle modification that we talk, the non-pharmacology things like a music therapy, like a meditation that helps, and then the pharmacological treatment like medicines and the brain stimulation. This one is transcranial magnetic stimulation and transcranial pulse stimulation. The major one is TMS here that we are talking today. So, what is brain stimulation? Have you ever seen this brain stimulation before? You like the ECT that's shown in the fancy movie, electrical shot to the brain. This is an ECT. You will see in the movie like the Frankenstein, something like that. But the TMS is not the ECT. Or some DBS, the deep brain stimulation from Parkinson's that help the patient to reduce tremor. So we will focus on the TMS today. So this is the core of the TMS, and this is a machine. This machine produces electromagnetic system and produce the magnetic field chain here, only the magnetic. It's not the magnet toy, not that easy. It's come from, and it applied to the head of this patient. We will see the result of the patient. She is a doctor, have a brain fog, and lost around 50% of her income per month because of the brain fog during the COVID. Okay, so we will see what is TMS.
On the surface, a depressed brain looks much like a healthy brain, but inside the differences are unmistakable. During depression, the brain isn't operating at full strength in the area responsible for emotion. Think of it as the brain's emotional control center. The emotional control center delivers signals along the neural pathways to and from the areas of the brain that determine how we act, react, and respond to situations, thoughts, and feelings. In a depressed brain, they have become less active or even inactive. In other words, signals that would normally regulate mood and emotions do not work properly in depression. This affects the brain's ability to naturally decode, evaluate, and react to what's happening around it. MagVenture TMS therapy is a safe, FDA-cleared, non-invasive treatment that uses short magnetic pulses to target the exact areas in the brain affected by depression, stimulating and strengthening these neural pathways. Like training a muscle, over time the inactive signals begin firing and reconnecting properly again, and thus restoring the emotional control center.
So it's not the toy magnet, it's just a Maxwell equation. I've heard that some of you here is the medical equipment engineering. Yeah, I've heard that. I just walked by and hear that. So it's just the Maxwell. It's just the Maxwell equation and Faraday's law to do this magnet induced field. And the TMS will stimulate directly the circuit, the neural cells, and the chemical substance inside the brain. So this is the mechanisms, but I will not dig deep into scientific chemistry. So, for example, when the patient have depression or feel blue, we stimulate the brain here on the left side, and then it will activate and suppress the emotional brain. This is the mechanisms. And you can see this is a depressed brain. And after the TMS, the brain functions recover. So we need to measure it in scientific measurement. And you see this. For dementia and TMS, this is the neuroplasticity of the normal aging. As we age, our cognitive ability decline year by year, right? Like this. But if you have the mild cognitive impairment or have the dementia, it will decline faster. And if you have Alzheimer's disease, it's the fastest. And the brain stimulation can improve and reverse this. But it's not permanent. Sure, it's not permanent. It's temporary. But because of this aging, now the natural cause of aging brain is getting worse and worse and worse. But how to keep our brain healthy as long as possible. This is important. Next. So the TMS caution is, as you see, that some stroke, aneurysm, or brain tumor, current seizure, we will not do the brain stimulation. And the TMS, the side effect can be transient, 1 to 3 days. Today, when you test the TMS already, you may have some discomfort already gone. The headache, anyone have the headache during the test? No? Okay, some syncope if you don't have breakfast or lunch before, because we stimulate 100 or 1,000 of million neurons. And fatigue in some patients, seizure in the right case, if the patients have epilepsy before. And this is me. I do the double stimulation technique. Okay. So, don't look into your notebook. Don't look into your book. Look at the screen. Answer to yourself, what are the 5 words that I ask you to remember? I take your time. Not yet, not yet. Answer in your mind. It's important. Try to recall it. This is important test. Okay, who want to answer? The first one? The second? Now, who remember all, please give the chance to others. And not yet, not yet. And the third one? Okay, okay, you know your answer. So, to be frank, to be sincere, who cannot remember all 5 words in the exact order, please raise your hand. This is a problem. Sure. And this, who feel that our brain is getting worse? Me, I think my brain is getting worse every year, sure. I forget many things. And who need your brain well? Sure. So that's why we create the Brain Well Medical. So, well is come from wisdom, energy, longevity, and love. This is the real effect of the brain stimulation. We give more wisdom, energy is more active. Longevity to the brain cells, we will know how and why, and laughter. So more laugh, more happiness. This is the result of the brain stimulation. So we will know the Brain Well Medical, and if I were you, I will have the question that this is trustable or is just an advertisement. So the BrainWell Medical, you can search the Google or you can ask the AI, the ChatGPT. You use the ChatGPT AI? You can ask the ChatGPT, who is BrainWell Medical? We very specialize in advanced brain stimulations in many brain and mental health conditions. And we have 3 full-time doctors right now, Dr. Prince, me, and Dr. Songtam. In 2035, we have rehabilitation, neuro, medicine, neurosurgery, the pediatrist, and soon the psychiatrist. And this is our team in Pattaya and our team in Bangkok, all the ladies. And then this is our core value, size, specialized, and sincere. We specialize, empathize on the brain fog, slow thought, dementia, Alzheimer's with the brain stimulation, but also the autism, speech problem, the gene mutation that have the delayed development or learning disorder. Many learning disorder patients who suffer from studying don't know that they have a brain problem. If we correct that problems, he getting better faster. So this is what we empathize. And then, so we are the pioneer in brain stimulation in Asia Pacific since 2011. I'm an international certified neuromodulation speaker and trainer. And next, this is 92 years old. Yeah, and before the brain stimulation, he said that I want to die. I want to take a pill and sleep forever because I'm boring. I have 11 illness, and 82 years old. Yeah, so after the TMS and TPS, the brain stimulation, both treatments, this is him. He go to the beach, enjoy eating out. Yeah, next. So the BrainWell algorithm, this is very important. TMS and TPS is just the name of the machine. Everyone who can buy this machine have the machine. But the important successful factor is the technique, the algorithm. The TMS or TPS is like a surgical knife. When you go to see a surgeon, it depends on the surgical knife or depends on the surgeon skill. You ask for surgical knife, the best surgical knife in the world, or you ask for the best surgeon skill. The TMS and TPS is the same. We developed the BrainWell algorithm, the technique that maximizes the result. In this patient, this is a quantitative EEG. It's not a classic EEG. It's measure the brain wave and to see what is the problem. The normal brain is in green, the green brain wave, but you see the dark blue sky here? This is a hypoactivation, hypoactive brain area. So these patients have the problem in this area a lot, in the left frontal side here. So if we can see this, we can do the test like a QEEG, Rolita, and connectivity graph, and we can use our BrainWell algorithm to do the right treatment on the right spot, not the blind treatment. Please. Okay. Okay, next. The TMS is called transcranial magnetic stimulation. Use the magnetic pulse from Maxwell. And our TMS BrainWell, the TMS technique, we experience is in all kinds of TMS in the world. And this is the TPS. TPS is the transcranial pulse stimulation, not shown in here today, but it's a non-invasive, painless, low-intensity shock wave. Penetrate 5 to 8 centimeters is painless to make more new vessels, new blood vessels. Okay, next. Our concept is lean, green, and clean. So we eliminate unnecessary luxury designs. You can see this data in our brochure, in our leaflet. Okay, next. So we are the trainer, the speaker of the TPS, the pioneer in Asia. And the TMS, if you visit the MagVenture.com, you can see our reference size, and we are close directly to the top of the expert of the TMS in the world from Denmark. Next, this is certification as a trainer. This is me as a speaker in the Asia Oceania Pacific Brain Stimulation Lecture. Next, and I train every university doctors in Thailand to do the TMS. So next, this is Kobe, Japan Brain Stimulation this year. Among the speaker, this is me. So next, and the co-authors of this ebook in the TMS chapter. So this is currently the academic knowledge and skill that we have. So we test every machine of the TMS on the market, and we select the best one. So you don't have to test with your brain. And every coil tested already, including the helmet coil. Next. So remember, this is very important that I said like a surgical knife. The normal TMS coil is like the first one, and it's produced on the right side, it's produced the small red dot stimulation. But our TMS brain well, we use the different coil type, the advanced one, and you see the red area is 10 times larger. So it's larger stimulation, and it's a faster response, so the patients can do less time, less frequency. And this is the result. The left side here is the hippocampus brain of the rat. And when we don't do the stimulation, we can see the new cell here in the circle on the left side. 2 circles is the new cells, the new brain cells, the memory cells. But if we do the 10 Hz of the TMS, on the right side, we see 5 circles of the new brain cells. So the new brain cell in hippocampus means you have more memory function. And this is what inside. And the TMS also improve the blood circulation, the cellular blood flow, improve around 30% in 30 minutes. And the oxygenation on the right side improved too. And it changed the small gate inside our membrane and can cause the calcium influx, the calcium inside the brain, like this, and activate the cascade inside our DNA and RNA to create the new brain cells. And this is a TPS, just for your knowledge. The TPS is the pulse wave stimulated in the green color here, and this is the vessels. The vessel of the brain, the first photo is the vessel before this TPS, and the lower photo is the vessels after the TPS. You see the different things? In the lower photo, they have more vessels, penetrates more and growing more after 3 months of the brain stimulation. So this is the severe Alzheimer patients who can sit quietly. After the brain stimulation, she has more response, more active and alert. And this is a 92 years old gentleman that I discussed before. Who is him? Yeah, it's me. So I'm the age 40s right now, so I have to clear my beta amyloid right now to prevent it. So I keep my brain clearer and sharper. And this is a businessman, 50 years old, and that's a 68 years old gentleman who have suffered a mild depression and slow calculation, slow thoughts. So both all of them do the maintenance, the prevention program. They don't have dementia, I don't have dementia, but I keep my brain clear and fast as much as I can to prevent the future dementia. So prevention is more important than treatment. When the Alzheimer's starts, it never stops. So this is our step. You can see inside our brochure in our website. So we test the brain activity, the QEEG, the 3D Rolita, and brain connectivity graph. So we can see what exact the right place to stimulate, not the blind stimulation. This is very important. So this is case of the brain fog, 7 months, slow thought, lost memory short term, lost attention and depression, ignore everyone, no creativity idea, and the financial reduced 50% of the brain fog. And her test, the MMSE, the MOCA test is the cognitive test, were normal but slow response. So then her quantitative, the brain mapping, so normal brain mapping should be in the green, but in the dark blue area there, the laser doesn't work, never mind. The dark blue area there is show us the slow thinking, slow thoughts of the brain oscillation, the brain wave. So this woman have the slow thoughts and confirmed by the QEEG. And after complete 3 months of the brain stimulation, this is before her drawing before the brain stimulation when he has brain fog, and after completed, yes. And the measure of the scientific mapping, you can see the difference after 3 months completion. So in the deep blue color, it's getting better to be more green, more normal. So brain fog, forgetfulness, and feeling down, reverse before it's too late, because if it happens, it may never stop. Do you have any questions?
I am curious, front left part of the brain,
Yes.
what function, brain function, does that have the most effect on us?
Okay. 2 answers. The first answer, the standard and old knowledge of the brain. We know we separate our brain into each area. The left side is for emotional control, intelligence, and the Broca area is for language. For example, if you want to speak, you need the Broca area on the left side to speak. This is a very basic and easy one, but not the detailed one. So the right side is, if the patients have the problem here, he will be anxiety. He will be like an OCD, like a obese to something, or he has the anxiety, worry about many things, or nervous, if he has the problem here, and also depression also. So the brain, the old knowledge, we divide the brain into separate parts, and each part function differently, but that's all. The new network neuroscience right now, we know that each spot is called hubs or nodes, can function 5 functions or 10 functions, depend on the network together. For example, when we are feeling broken heart, have you have a heart broken? Me too. So when we have a broken heart, we have depressed, we have sadness, and this brain on the left side, the DLPFC, will activate more to help the depressed feeling, the broken heart feeling, or the lost feeling when we lost our loved wife, son, daughter. So this brain active more and more and more to help us. So from the brain mapping, we will know that in this patient, what the brain is lower or hyper. If it's too hyper, we don't touch it. If it's lower, we stimulate and help it. So every brain's area have a different functions, and it can work together as a network. Yeah.
Sorry, you asked us to remember 5 words. Einstein said, we never, or I never, remember anything I can find in a book.
Yes.
Because that affects the creativity of his mind. How does that coincide with what you're talking about?
So it's not right or wrong. This is the memory test. If you can memorize that 5 words, it shows us that your memory, your brain is still intact. But as Einstein said, or anyone else, or including me, I don't remember things that I don't care, right? So I keep my brain to do the functions, like I keep my brain to do the presentation. not remember some numbers that is in the books. You are right. But this is the test, the memory test. If the person in this room can remember 5 in exact order, well, it can ensure that his brain is quite good. But yes, you are not wrong. You are not right. It's the fact. Yes.
I think that answer is you're not Einstein. So. Okay, two things put together: fatigue and attention deficit. Do you look at these things like severe fatigue that kind of comes and goes, but it doesn't feel like depression? It feels just like really being tired. And then second is the inability to read more than 10 minutes without fading off. Does this kind of thing handle those 2 items?
Okay. If the problems come from the hardware, we separate into hardware and software. The brain cells, the connectivity, the connection into the brain is the hardware, right? If you have some stroke, some dementia, small brain atrophy, you have the hardware problem. And the brain stimulation can help the hardware to make it faster or have more blood supply to the brain. If you remember the slide of the red cells, the before and after. But if this problem comes from the software, or like many generations right now, they do the cell phone, the mobile phone very, very often, so they lost concentration and focus easier. So that's the software, not the hardware. So if your problems are from the software, I cannot help. But if the problem comes from hardware, we can help. Yeah.
Dr. Davey.
Hello. Thank you very much for a very interesting and broad talk, and I saw that you talked about lots of the other possible things that people can adjust, lifestyle and that sort of thing, to help with things like, for example, depression. I'm a bit concerned because I know it's a relatively new technology, so it's hard to kind of get sufficient studies, but I've had a dive through the literature, and there don't seem to be many studies that are unbiased, particularly ones that quote these effects like 400% improvement or 95% improvement in stroke and that kind of thing. And I'm aware, there are studies that are sponsored or by MagVenture and companies like that, but it's like a drug company sponsoring trials of its own medicine, and in a way then it's very hard to be objective. If you're sponsoring your own thing, you might say, well, of course it works. So I'm quite concerned, and particularly there are some studies that don't appear so biased, but even those, because there's all these factors in the background like placebo effect, like that, people might just get better if they take a placebo pill. There's Hawthorne effects, which are that if you're participating in a study, that the very act of participating in it and the camaraderie and the involvement, that creates an improvement as well. Those things are called sham effects. And then there's also the natural history of particular things, like the natural history of brain fog or the natural history of depression. And those can improve dramatically, can't they, over time without any intervention at all. And the other thing is a study sufficiently powered? Is it big enough that we can say there's enough data in an unbiased study that you can say, well, this has been a huge population that's been tested, and yes, we can say there's a sufficient, what they call a power, to actually say this is a positive thing. And now, there don't seem to be for many applications of TMS. The only one is that the Cochrane collaboration, which is this big international body that looks at studies and their effectiveness. And the Cochrane collaboration in 2019 did a review of TMS for depression. And the TMS, what they found was that, yes, in young people, this is the other thing, in young people, the response might be different to in older people when the brain's less plastic and has less volume and, has all these other changes that you speak about, but in the Cochrane collaboration, it sounded like that they thought, well, there might be a 35% improvement in young adults, or 40%.
Sorry to disrupt, but we have to keep the time. So what is your questions or your suggestions?
Well, I think that it's fair enough that there isn't enough data, because I know that it's very hard to get.
I love that.
So how much does it cost per session? And I just think that, you know, the effect size for me is concerning. And what do you claim? Because if you say that it's 400%...
It's not a claim, sorry, it's a fact. Every number inside the leaflet is a fact and can proved. So the first thing is don't trust, just proof. This is my first word, right? So I never trust any doctors, including me, because humans have bias. Human always have error. I don't believe in human. I believe in science, scientific method, methodology. And what you discuss is very good, because it's a lot of discussion here. You say this. This is the International Brain Stimulation Conference in Kobe this year, February. And it's a very, very advanced, more than the publication Cochrane Review, because Cochrane Review is good and it's one of the standard of the world. But we have to dig deep into the methods. There are many details, and we would love to. You can bring me the meta-analysis paper, and I will point you what is the pro and con of each papers. And every number in the leaflet, yes, it may look too impressive, but it's only the fact. Especially in the autism, we are the international pioneer of autism brain stimulation. Don't trust, just prove. Your suggestion is very good, and it reminds all of us here in the audience that we have to have a critical thinking, not to believe in anyone else easier. I believe that you haven't believed yet, but just prove scientifically.
We've got a couple more questions.
As a testimonial in favor of TMS, in the US, when there's a failure of response to depression as a result of conventional accepted pharmaceutical medication, the Food and Drug Administration approves TMS as an alternative, and Medicare will pay for it. Medicare doesn't pay easily for things. So they need numbers, they need statistics, they're anal like anything. So that's the way it is. I'm talking only about clinical depression that has failed to respond to conventional pharmaceutical therapy.
Okay, thank you for your opinion. Yes, that's right. In US, there are many regulations of the TMS. It's around the Medicare around 60 to 65 sessions limitation for depression that you said. And we have, in fact, I have another lecture about depression. Dig deep into what you suggest. That's very good. And what you tell us. Thank you.
All right, question right up the back. Probably the last one.
Thank you, doctor. It's been very informative. And I'm actually right there with you about don't trust your doctor, because I have evidence of a bad leg from a bad surgeon, etc. However, now I'm seeing a doctor at Bangkok Pattaya Hospital because a couple of years ago I had too much water on my brain, causing me to fall, and the answer was putting in a drain and a shunt. And so if I were to take advantage of your technology, I would probably then have to see the doctor again to reset my shunt because it's magnetically controlled.
Okay. If you see the lady sit in the wheelchair, she has a normal pressure hydrocephalus, the water inside her brain, and she has a shunt already. And the brain stimulation, I will show you this one. She has the water in the brain, the normal pressure hydrocephalus. I have to work in Bangkok Pattaya Hospital. I work with a neurosurgeon who perform the shunt replacement and do the brain stimulation for this kind of patient. To improve, we cannot fix and cure 100% impossible, but we improve the brain connectivity. It's thinking faster, more arousal, more sensation, or faster speed of the motor movement and emotion.
All right, one last question. John up the back has promised me it's a short one.
Oh, Doc. Short question. I sometimes go from a area and I walk towards the bathroom or the kitchen, and then I forgot what I was going there for. Sometimes I have to go back to think of what I was going there for. Have I got a problem? Thank you.
It's a real problem if you're actually going to the toilet and can't remember why you went there.
So how old are you, excuse me, mister? How old are you, sir? How old are you?
85.
85. So as I show you in the graph that as we age, our cognitive function and memory decline year by year. But for your conditions, brain stimulate, you need to adapt every factors first, and you need exercise and the brain training first. After you do the maximize of the software training, exercise, the brain stimulation will make your nerve fiber, the white matter, communicate faster. And also the stimulation for the, if you see the TPS in the lecture, the TPS in Bangkok branch, sorry, not in Pattaya yet, because it's the first machine in Thailand. And it improved the blood circulation, improved the blood vessels. So the more blood vessels, more nutrients, more cell growth, and more memory, the neural stem cells grow more and more. So it can help you, but not permanently. It will help for temporarily. For me and many clients who don't have the disease, but we keep the brain stimulation around 1 to 2 sessions per month to keep our brain faster and still active, have less memory problem.
So, thank you very much. And I know that some of them still need to consult with doctor. So, you want to present this first? All right. Picture? Okay. So.
Well, thank you, Doctor, because everybody learned something here today, I think, for sure, right? So thank you so much. One more picture. 100 baht, okay?
อาจารย์ถ่ายรูปอีกรอบนึงไม่เป็นไรค่ะ